So we will be going to the second presentation. Dr. Ajay Kapoor sir, leveraging ultra wide field imaging to uncover the hidden threads in the retinal periphery. Ma'am, please join me on the dais.
Good evening, everyone. I thank the organizers for giving me this opportunity to speak on Widefield angiography system. To be honest with you, for whole of my life, my retina career, I had been using a conventional fundus camera with a very small field and always wanted to have a wide field camera once it was available in the market. But since these machines don't come cheap, so it was only recently that the center could afford to buy one of these, and today I'm here before you speaking about this machine. So as you can see from this image, the traditional fundus camera captures only the central retina, and in order to have a wider view, you need to ask the patient to look right, left, center, up and down, which is a really very cumbersome thing. So today I'm talking about wide field fundus camera by Zeiss, it's known as Claris, and it captures beautiful images even in a non-mydriatic pupil, and we will be talking of color, clarity, and the extent of the images. It's a very patient-friendly machine. Patient can sit very comfortably, and it's very user-friendly. The doctor or the technician who is doing the angiography or fundus photography can also have a very good view on this very wide field screen which is available. And here in this picture, you can see what we see in the fundus with various modalities. The central rectangular slit is what you see on a slit lamp with a 90-degree lens. And with the direct ophthalmoscope is a small circle around the disc. Of course, this is, I would say, not a true representation when you're talking of an indirect or a direct ophthalmoscope, because it's a dynamic process. As you are seeing, you are continuously moving yourself and asking the patient to move the eye. However, if you see that the traditional fundus photography of 45-degree and see the difference between a wide field photography of Claris, which is a very large view, and with montage and ultra wide field, it really captures almost all of the fundus. Here in this picture, you can see all these things much more clearly. So a wide field is 133 degrees of field, and this machine particularly has a true color representation, and we are used to seeing true colors, not the pseudo colors what are available with other machines. And ultra wide field modality gives you 200 degrees of field, and with 6 images montage gives you 267 degrees of field, which is really very large field, and you can capture all the dangers which are lurking in the periphery. And even the anterior segment colleagues who will be using this machine can really diagnose retinal conditions and appropriately refer the patient to their retinal colleagues. So this slide tells us what all the machine can do, from external eye photography to color photography to FAF, which is fundus autofluorescence, and FFA, fundus fluorescent angiography. And their technology of precision focus makes sure that all the areas are in focus. You don't need to manually focus it, which is again a very big advantage. Again, older machines we used to adjust the brightness, because once the dye starts leaking or pooling, with the same level of brightness, you get really very bad overexposed images, but not in this machine. So here you can see that in the initial early phases, you can see the dark occluded vessel, and as the dye leaks more, there is no overexposure, there is no bright fluorescence, it's a normal thing. And here is the retinal case of retinal detachment, in which you can see the extent of detachment. And recently, sharing your personal experience, I was not available in the center where I work. The anterior segment colleague, he clicked a photograph of a patient, and he sent me the picture, and he had already diagnosed the case as having retinal detachment, which he would not have diagnosed on direct ophthalmoscope, which he usually uses. And in earlier days, I used to tell them to send me pictures by asking the patient to look up, down, and like this. Now in one image, I could plan my surgery sitting 200 kilometers away. Here again, case of retinal detachment. You can see a beautifully captured HST superiorly, and the other image is post repair. In diabetic retinopathy, you can capture the images of macula as well as the periphery, where there may be subtle neovascularizations. And again, the beauty of this machine is, as much as you may magnify, there is no pixelation. So you can have a neovascularization which is in the periphery, as well as macular edema or leaking microaneurysms in the macula, which you can simultaneously photograph and document and show to the patient. This image shows very well done PRP with a multifocal spot laser. See a small hemorrhage in one of the quadrants one does not miss diabetic retinopathy, you can easily diagnose. And these images show comparison between the competitor, between other machine available in the market. You can see this machine with true color is really more appealing to the eye, and diagnosis will be much more easier. Similarly, in this case, you can again see these images. So this is a fundus autofluorescence picture. Again, comparison of clarity. The picture of CRO, you see the whiteness on the true color image is what we are more used to seeing. And here in the again other machine, there is a lot of eyelashes which come into the play, but not in this machine, and you get beautiful pictures. So this is a case of branch retinal artery occlusion. See this pallor easily seen to what extent it is going in the periphery. And these are the fundus fluorescein angiography images. So even for the glaucoma colleagues who want to photograph the disc, this machine comes into play because there is no pixelation and disc will be captured beautifully, and other signs of glaucoma too can be analyzed on the color photo image. So drusen's, which optic disc drusen's, which give rise to pseudopapilledema appearance, again on fundus autofluorescence, diagnosed very well with this machine. So here you have a PDR case with IRMAs. I would have liked to see, an image with IRMA's magnified image, but that's not available. But with this Widefield FFA image, you can see small early neovascularizations, and patient needs PRP. So old case of CRVO with macular edema, you can see the leakage in macula in the center with dilated tortuous vessels. And if you see a lot of capillary non-perfusion in the periphery, then the patient needs an laser also. Here is the case of BRVO. So now here is what I was talking of, that you can magnify the image from the complete to macula only, and there will be no pixelation. So you can see this is a case of PED with subretinal hemorrhage, serious detachment is there, and this machine, because it captures things beautifully, you can even see a hyperreflective polyp, which is responsible for this. A case of Eales disease, very common in our country. See the level of capillary non-perfusion and the contrast which provides you, which lets you see the non-perfusion, and treatment can be planned accordingly. A case of FEVR, which we may not be seeing in everyday life, but again periphery ischemia and tortuous blood vessels with new vessels is easily seen. So here's a case of diabetic macular edema with peripheral non-perfusion. This is a case of CSC or CSCR, as we know, and these diseases like CSR, where you can see leakage in traditional FFA, you cannot see it on Octa images. So here comes the role of FFA, and for old timer like me, FFA is yet not dead. It has a lot of role to play in my OPD. Thank you.
Very well shown pictures. Just a quick question. So it's basically one machine which is giving you all the options, right?
Yes.
And any option of a video fluorescein angiograms available?
No.
Like, can you? Just to add on to one point that Sir has very clearly pointed out, that fluorescein angiograms are not outdated yet, especially in cases of CSCs, and even in uveitis, fluorescein angiograms still has a role, and you can't completely rely on Octa images in those cases.